hip self-help exercises can be done in lying position on the bed or in standing position. Now if you lay down, correct the hip, all you need to do is you bring your knee and upper thigh to a 90-degree angle, the knee preferably tilted out a little bit. You place your hand on the greater trochanter here, give resistance inward and upward by simply pulling on the leg and pressing inward, and then you lay down the leg completely. I repeat, you bring up the leg, tilt the knee a little bit out, apply pressure on the greater trochanter by placing your hand around the thigh, pulling and pushing at the same time. When you bring down the leg, relax and exhale. Repeat this 3 times as demonstrated. You repeat with the other side. An alternative, you may use a rolled up towel. This towel you can bring around your thigh here. Hold the towel. Now the knee a little bit outwards. When the leg is brought down now, you quite firmly, without causing pain, pull on the towel with your outer hand like that. Release the pressure when the leg is down. You repeat on the other side. Now in standing position, you can stand, make sure you hold yourself somewhere, bring your leg to 90 degree, knee a little bit out, place your hand, apply pressure, 1, 2, 3, turn around, do the other side. That's it. Repeat this exercise about 10 to 20 times during the day for the first 2 months. Later on, at least 2 times a day, preferably in the morning before standing up, and in the evening when you're already laying in bed before you sleep. It's never a mistake to do these exercises more often for the rest of your life, especially after any sports, stretching, yoga and the like, as the last exercise to ensure your hip is in the proper position. Now the self-help realigning exercises for the sacrum. You can use any bench, bed or hard firm table that has an edge and a right angle corner like here, not too high. Now one of the exercises is you lay down, slide down so your bum is sticking out a little bit, the hip is on the edge. You hold yourself firmly, and all you need to do now is going up and down, not bicycling, in a relaxed manner. You can change the height. You can do it with straight legs if you have to strengthen your abdominal muscles. For about 30 seconds. When you stand up, make sure you do it stable. Do not do these exercises if it causes any pain. For the other one, you need the corner, the tip on the corner. Your sacrum you find in between your bum muscles here. The bone, tailbone, should be in line with the corner, the tip. Now what you do, you bring these two together, hold yourself firmly, and now when you lift your legs, you sit with your sacrum at the corner of this, and you do exactly the same movement. Again, if you can do it with straight legs, for about half a minute or longer if you want to, and relax. That is a very effective exercise. Now another possibility I show you on the floor. An alternative sacrum exercise can be done on the floor. What you would need is any ball about the size of your fist. Ideal would be a tennis ball or a massage ball, like that. Now remember, we need pressure onto the coccyx, like on the corner of the table, or an alternative which is replaced by this ball. Now in this case, we lay flat on the floor. We use this ball, place it under the coccyx by simply lifting. Now in this position, this ball is supposed to press onto the coccyx. We can hold it with our hands like that, form a triangle, hands straight. Now if we lay down now, our coccyx is placed exactly on this ball. All we need now is the movement, which is done exactly in the same manner. Simply up and down, or with straight legs if you can. We do this exercise for at least 30 seconds, only if there's no pain. Stand up, turn to the side, push yourself up. For another very good sacrum and general spine exercise to stretch and to make it flexible, you can use two chairs which are high enough and stable enough, like these dining chairs. They replace the bars when you're doing gymnastics, for example. Now what we do, we place ourselves in between these chairs. We hold ourselves, if you're strong enough to do that, of course. What you want to do is, you want to push yourself up so that your legs are in the air, like that. Now in this position, you simply do walking movements. You can do this with straight legs, bended legs. You can also wiggle your spine, stretch it. Now the movement is the most important factor. Make sure you do it stable. Do it as long as you can, preferably at least 30 seconds. Of course you can make breaks in between. Another easy possibility to correct misalignments in the sacrum is replacing the therapy by placing your fist onto right or left upper area of your hip plate, the posterior superior iliac spine, where usually there's two dimples. Now use the flat side of your fist, placing it onto it. You want to apply gentle pressure onto this while holding onto a chair or similar with the other hand. Now, when your leg is now doing a nice swing, you push whenever the leg is on the backswing. So, push, 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 push. The pushing is directed to the front. You exhale while pushing. You may do this while swinging with the other leg, like that. After half a minute, 1 minute, you repeat it with the other side. Now, when we want to correct our lumbar spine, any misalignments in these areas of vertebra 1 to 5 here, we can use our thumb to place it on the left or right side and apply gentle pressure against the spinous processes, or from the other side, on our own back, while the leg again is doing swinging motions. Now this area is difficult to reach, but with our own thumbs we can manage to do this. I will demonstrate it on my own body. Now again, you stand on a chair. Make sure you can reach your spine in the lower area. You can use a little bit oil, rub it in this area. What we need is our thumb. For the right side we use our right thumb. For the left side we use our left thumb. For example, we want to treat our lower spine, lumbar 1 to 5. We first need to find 5, which we look for our dimple area here. Meet in the middle. Now that is lumbar 5 and it goes up here. Now we place our left side thumb, for example here, on the upper part, lumbar 1. And then we palpate downwards to look for tense or hard or painful areas. Or we simply start on top, slowly moving down. Now whenever we apply gentle pressure against the spinous processes in this direction towards the middle, while our leg, either opposite or same side, is swinging like that. After about 30 seconds we may change position a little bit down to reach the next lower vertebra. And again move downwards. And again move downwards until we reach the lowest lumbar 5 and start touching the sacrum. You may finish by sliding down. Repeat this on the other side. Change position downwards. If we want to treat our cervical spine, to realign it, we need 3 positions to consider. The first one is using our thumbs.